Hello, everyone. This video is intended to recap everything that we saw about the endocrine system, uh, basically to help you remember some of the concepts or to review some of the things that may have been forgotten at this point, right? So with the endocrine system, we have talked about before how this entire system is actually made up of different glands, and all of them from the category of endocrine glands. And there's, the communication and the cooperation between them in order to achieve a particular change or effect in the body overall, right? So the main point in here is about the regulation that is happening in your body, either during your throughout your life or in different scenarios or situations, such as some of them that we have learned about before in the nervous system during the sympathetic or parasympathetic responses, or maybe in a cyclic way, for example, during the sleep cycle or the menstrual cycle, for example. Right? So key points to fully understand this lecture in here is the mechanisms of the hormone control, both the positive and the negative feedback. So what does it mean, negative feedback and positive feedback? To know the different glands that make up the system, as well as the hormones that they make individually, as well as the functions. So basically is to fully understand the connection between which gland makes which hormone and for what. And sometimes there's a chain effect where this gland creates this hormone that will stimulate the other gland, the next gland, and the next gland will create another hormone that will have another impact, right? And in the final part of this lecture will be regarding the disorders or the diseases that are related to the endocrine system. So first of all, so what's an endocrine gland, right? Back in digestive system, we talked about a different type of gland, which is the exocrine gland, right? So we have these two type of glands, which are the exocrine and the endocrine gland. Remember, exo means towards the outside. So back in digestive system, we talked about glands such as salivary gland. We talked about the sebaceous gland. We talked about, how the pancreas actually makes bicarbonate and digestive enzymes as well. And the main point of the exocrine gland is that it makes, there's some cells that create a product or create something, and it will expel it towards a duct, towards the outside of the system. For example, the sweat will be a good example, right? So it's pushing us towards the outside of the body or the system, right? Also included in here are, for example, the salivary glands. Even though the saliva and the salivary amylase, which is the enzyme that it makes, it's being pushed towards the mouth, if it's in the digestive system, technically speaking, is also outside of the body. Remember, the digestive system has an opening and has an exit, right? So if everything that is inside of that opening or that tunnel is still considered to be outside of the body. So salivary glands would be still exocrine, even though they're releasing saliva and stuff into the mouth, right? Same goes for the pancreas, for the bicarbonate, or in the stomach that is producing pepsin and is producing the acid. It's being thrown into the stomach, but it's still part of the tube of the digestive system. So technically speaking, all of these are exocrine glands, right? So what's the difference then? What about an endocrine gland? The endocrine gland, technically speaking, is releasing its hormones, number one. The product that it creates is a hormone, and it's releasing it towards the inside of a capillary. Remember capillaries from circulatory system? Basically the blood, right? So the contents of these cells, which is a hormone, will be released into the blood system or the circulatory system. That by definition means that it's inside of the body, right? Because it will continue circulating, to the heart, to the lung, everywhere inside of the body until it reaches its final destination point, right? So what's a hormone for? So these hormones can actually affect or have an impact in the metabolism of the cell, basically how fast or how slow the cells are working as a factory. Remember, every single cell is like a factory, so it depends on how fast or how slow it's working, the overall effect that it will have in the body. Also for growth and development, especially during childhood and the puberty stages, teens, but also in adulthood and every single moment of life, there's still some development going on or some growth going on, right? So basically it's for life, as long as you're alive, right? And homeostasis. Homeostasis, remember, is another word or the technical word for keeping everything in balance in the body, right? So some things to consider about the endocrine glands are that different from the exocrine glands is that the endocrine have no ducts. That means this tube that connects the gland towards the outside of the system. For example, the sweat glands, right? They have a duct where the sweat is coming out, but endocrine glands have no ducts. They immediately release or directly release the hormone into the blood system, right? And they also will secrete the hormones directly into tissues, right? Or it can directly release them to the bloodstream, as I just previously mentioned, right? So these are like the important differences between an exocrine and an endocrine gland. Now, this is important, especially heading towards the final exam, where all these contents will be in the same exam, right? So in order for you to have clarity of what's going on between a gland, which one is an exocrine and which one is an endocrine. Now, the endocrine system basically will have or is made up of glands and tissues that secrete hormones, right? This is basically the definition or the concept behind what the endocrine system is, right? And a hormone, technically speaking, is a chemical that will affect other glands or other tissues, depending on which hormone is it, right? Most of the time is something that is physically far away from the original um, point or the original place of where this gland is being released, right? So just to keep in mind this important concept of balance, which is called the homeostasis. This homeostasis basically requires the cooperation of both the endocrine and nervous systems. So back when we were talking about the nervous system, we talked about this reflex arc that if you're hurting yourself, then there's a reaction in order to remove it really fast, right? But in reality, homeostasis, like talking about the entire body system, is a cooperation between both of them. Neither can work as effectively or as fast without the other. So it's actually a cooperation between these two. So where in the nervous system, we can actually have, receptors for temperature, for example, for heat. We have a lot of, increasing temperature in the system. Then we have a response, which is sweat, right? And as we continue to sweat, then the temperature lowers and then we come back into normal, right? If the temperature drops significantly, then we start shivering in an effort to try to get back some of the heat into our system, right? So at the end is basically this nervous system, in this case, that is reacting, but similarly, in other more complex mechanisms, the receptors will send a signal to the brain or to individual glands to start triggering a chain effect or to start triggering a reaction that sometimes takes longer than just an arc reflex, right? In order to keep the entire system in balance. This is important to keep it in mind for the rest of the lecture. So this type of reaction or this type of feedback, we call feedback this, reactions from the body, we can have two different scenarios. We can have the usual one that we have talked about many times, or the best example for this is the negative feedback. By definition, the negative feedback basically is cutting the stimulus or trying to react in a way that it will cut the original stimulus to get back into the normal stage, right? So if we have a drop in temperature, we start shaking in an effort to try to bring back the temperature to the original stage, right? And therefore eliminate this stimulus. This is the typical example that we have spoken throughout the semester of type of feedback, of the negative feedback, right? But in the endocrine system, we also have a lot of examples where we have the opposite, which is a positive feedback. Now, positive feedback basically means that the signal or the stimulus, rather than being interrupted, is stimulated even more. And the best example would be, for example, breastfeeding. In the breastfeeding situation, we have the stimulus by the baby that will trigger a signal in the brain of the mother to keep releasing two particular hormones. We'll get into detail later about this too. But prolactin and oxytocin are further stimulated so we can have more milk production and milk ejection, right, of the mother. So the baby can feed even more. And as the baby continues to be fed, then there's further stimulus for more hormones to keep being produced. So there's more production of milk, more ejection of milk, and the baby can continue to feed, right? And as the baby continues to feed, there's more hormones. And so basically it keeps having this positive effect where there's more and more and more every single time. How is this ended? With a strong interruption of the stimulus, right? In this case would be like the baby stops being breastfed, and that as a consequence will stop the signal in the brain of the mother of being releasing prolactin and oxytocin, right? Now, some other general aspects of hormones, we can talk about two types, chemically speaking. We can have hormones that are basically from protein, right? Protein, the biomolecule protein, which will have certain reaction or a certain behavior. And the best example of this would be the hormone insulin. Now, insulin is being produced in the pancreas, and as we will see in a moment, the purpose is to lower the glucose level or the sugar level from the blood, right? But there are other types of hormones which are based on lipids, right? Which is, or in this case, is basically cholesterol, right? Cholesterol is one type of lipid. Remember, lipid is fat. So we can have either protein-based or fat-based hormones. So whenever we talk about the lipid or the fat-based hormones, we're going to be talking about a steroid type of hormone, right? Now, the steroid, by definition, is this diagram that you see here, where you have four rings connected. You see there's three hexagon-shaped and one pentagon-shaped. This is a molecule of cholesterol, and cholesterol acts as a base structure, and stuff will be getting connected. And depending on this, it will be all the different types of steroid hormones that we will have. For example, testosterone, estrogens, progesterone, all of these, especially the sex-related hormones, are going to be based on the cholesterol molecule, right? So overall, as we have mentioned before, there's an interconnection or a relationship between the nervous system that we have studied just previously and the endocrine system. So whereas the nervous system usually works with electricity, right? We call this a nerve impulse or the action potential. Remember this? We would have an action potential or a nerve impulse. That means that the response is going to be fast, like the arc reflex, right? But usually, because we act fast and we use electricity and the whole purpose is to have a quick reaction, usually we have a less prolonged response. That means this is not very good in the sense of a long-term effect in the body. We want to have something quickly done, and quick response to get at a danger or to have a quick reaction in the body for a specific purpose, right? So if we want to have a more prolonged response or a more long-term effect in the body, that's where the endocrine system actually kicks in. The endocrine system is mostly about regulation, as we saw before, about the positive or negative feedback loop, where these hormones is going to be the main action or the main responsible for the effect in the body. But the downside of this is that it has a slow response. It has a slow response, but because it's actually making changes in tissues, changes in organs, changes in levels, quantity levels throughout the body or the system. But the good thing of this is that we have a more prolonged response. That means that this change or effect will be for a longer period of time, right? So the endocrine system, we have mostly connection between glands via the circulatory system, right? So blood actually is the one that is going to be having all these interconnections between all of these different glands, and between them, they also communicate, right? So which glands make up the endocrine system? There are a lot. So we can start by identifying them by name and location, which is by itself already a first step into this whole thing, right? In the brain, let's see in the whole brain, right? In the brain structure, we have three. We have the hypothalamus, which is technically speaking not a gland. This is, we can say that the hypothalamus is the interconnection between the nervous system and the endocrine system, right? Is the bridge between the neurons and the glands, right? Because the hypothalamus will trigger a response or will send a signal to the pituitary gland, which is located immediately below it. But the pituitary gland is already considered a gland, right? The hypothalamus will be the bridge that will send the signal or the trigger the response to the pituitary gland, right? We also have also in the brain, but in the backside. So if the pituitary is right here, the pineal gland is in the opposite side of the brain, right? Same height, but on the opposite side, which is the pineal gland. This pineal gland is where, well, a lot of things will happen, but mostly the melatonin or the, let's say the hormone or that is in charge of producing or inducing drowsiness stage or in order for you to go to sleep. This is where this is produced, right? So in the brain area, we have hypothalamus, pituitary, and the pineal gland. Then we go into the neck area, right? Into the neck area, we have two, the thyroid and the parathyroid. These two are actually in the same location. They're actually a little bit like anterior from your neck, usually around this area. And the parathyroid is actually an independent gland that is located on top, let's say on the surface of the thyroid gland, right? In the sternum, right in the midline of the thoracic cavity, we have the thymus, which has immunological work and immunological action, mostly during early childhood. Eventually starts to lose its overall function as you grow up. But this is where most, well, not most, but some of the white blood cells are actually given birth or created, right? Now, going into the abdominal area, we would have the adrenal gland located just on top of the kidney, right? Now, the kidney is not part of the endocrine system, strictly speaking, because it's part of the urinary system. It creates urine and has other functions. But it's a quick reference for you to identify where the adrenal gland is located. And going, so these are in the lateral sides. Going to the midline, you would have the pancreas, which is an important organ that actually plays both roles. The exocrine role, as we saw in the digestive system, bicarbonate digestive enzymes, and the endocrine role, which will create insulin and glucagon, as we will see in a moment, right? Now, between the kidney and the adrenal gland, this is where cortisol and adrenaline and noradrenaline are going to be released. These are for the fight or flight response that we saw back in the nervous system, right? Now, going into the pelvic cavity, we will have the gonads and the organs that are related to the reproductive system, as we will see in the next lecture. So in females, we will have ovary and uterus, and in males, we will have the testes, right? So basically, if you start to join or put together the information according to the levels in the body, like the brain, neck, thoracic cavity, abdominal cavity, and pelvic cavity, it's actually a little bit easier, I think, to organize this information. All right, so now let's see details about each individual glands or groups of glands, right? So in the first part, we will have the hypothalamus and the pituitary gland. Now, this by itself includes a lot of hormones already. So let's start from here, right? Now, this pituitary gland is actually a very small gland that is located in the anterior and inferior part of the brain, right? So if you would have to see from the front, it would be like in between the eyes, a little bit towards the back, right? If you see a lateral side of a cranial X-ray, you would see this small, let me put another color, you would see this small area in here on one of the bones from the cranium, where actually this is going to be the place where this particular gland will actually be sitting down, right? Or be suspended, right? And this small gland actually has a lot of work to do. So if we see a model of the tissue of the brain, remember in the nervous system, whenever we talk about brain, we talked about three different things, right? We talked about the cerebrum, we talked about the cerebellum, and we talked about the brainstem, right? Brainstem, which is this area, right? We're going to include, now that we're studying the endocrine system, in the same category of brain, these two, the hypothalamus, which is this area that we have here. Remember, this is the bridge between the nervous system and the endocrine system, which is this part, which is the pituitary gland, right? So there's a connection, there's a bridge between the nervous system and the endocrine system. And this is one of the best examples to understand this. The hypothalamus will send signals and instructions to the pituitary gland to start doing something in particular, right? In the hypothalamus, this is actually the place where we have a lot of the command centers for many of the functions of the body, including the hunger command center or the thirst command center, or the sleeping instruction set, and many others, right? You don't need to know all of this, but just to understand that this is like the main command center where many of the functions are going to be controlled with the body, right? And depending on the order or the command, instructions will be sent towards the pituitary gland, and the pituitary gland will react depending on these instructions, right? Now, the pituitary gland by itself, we can split it in two parts. We can see it in the anterior pituitary, which it would be represented by this part, the one that is pointing to the front. Remember, anterior is to the front. And the posterior pituitary, which will be the one that is pointing towards the back, right? So the cerebellum is back here. So the one that is in the diagram towards the cerebellum, that's the posterior part, right? And why is this important? Because depending on the area of the pituitary, different hormones will be secreted or will be expelled, right? So in the hypothalamus, as I was just mentioning you, this one is the bridge between the nervous system and the endocrine system. And if you remember from the nervous system, we have an entire branch that works automatically that we call the autonomic nervous system. If you remember, this one was further divided into the sympathetic and the parasympathetic, right? Which is the fight or flight, rest and digest, right? So these functions are not controlled by you or not defined by voluntary control, thankfully. And these include, for example, how fast your heart is beating, right? Or how intense the pressure is going to be in your arteries due to your heart, right? How much appetite are you going to have? What is going to be the body temperature ideal for your body? What amount of water is okay that you have still in your system, right? Before throwing it all away, before in the kidney, right? So all of these functions will send instructions to the pituitary gland to two special places, the posterior or the anterior part. And depending on which part of the pituitary, we will have special hormones being released according to the location of each, right? So let's start by analyzing first the posterior pituitary, the one that is towards the back, right? So in the posterior pituitary, remember in the diagrams, it's usually going to be the one on the right because the cerebellum will be here, right? So in the posterior pituitary, I recommend that you start with this one because it has only two hormones, right? You only need to be familiar with two hormones in here. The first one is the anti-diuretic hormone, right? Or the hormone that is going to avoid diuresis. What is diuresis? Diuresis is the technical term for urine production. So we have a hormone to avoid making urine, or at least a lot of urine, right? What would happen if you make urine without any control? Basically, you dehydrate, right? All this water is going to be lost through urine, and therefore you will eventually dehydrate completely. So you don't want that. You want to have enough water in your body. Remember, usually 70% of the body is water. So you want to keep that water balance always in the correct ideal stage, right? Homeostasis. Therefore, you will have a hormone that is in charge only for that. This is one of the two hormones that are made in the posterior pituitary, right? Now, the other hormone that is being created here is the oxytocin. Oxytocin is the one that I used as an example for positive feedback, right? The one that is going to be released from the mother's brain in order to continue the breastfeeding process, or during childbirth is the hormone that is released to continue making contractions in the uterus to keep pushing the baby outside, right? Oxytocin is also produced in men. This is also named as the love hormone, which creates, this like emotional attachment between humans, I guess. So being specific about the antidiuretic hormone, which is the first example from posterior pituitary, this one is going to be released due to low level of water in the system. If you're running very low of water, let's say less than 70%, then the antidiuretic hormone will be released by the posterior pituitary gland, right? And it will be thrown into the blood, and it will eventually reach the kidney and send the signal to stop throwing away the water. We need all the water that we can get. So don't make more urine. We're running low of water, right? So the kidneys will eventually shut down and all the water will be staying inside, right? In other words, due to the work or to the process of how the kidney works, there will also be an increased reabsorption of water. So it's not exactly that we are shutting down and the kidney stops working, but more and more water that is being thrown is going to be picked up. It's like changing the money. We threw it away because we cannot avoid it. The kidney works like that. It throws away water, but we can actually pick it up, right? So we can all reabsorb all the water that we can just as in the digestive system, in the large intestine is the reabsorption of water in the last minute in order to not have diarrhea. In the kidney also, we reabsorb all the water, so there's not a lot of loss of water, right? Now, when the water level comes back to normal, right? So negative feedback, the water level comes back to, let's say, 70%, then the stimulus stops and there's no more ADH being released, and the kidney goes back to its normal function, filtering, reabsorption, right? Now for oxytocin, which was the second one from posterior pituitary, I'm making a, more specific about each of the hormones. Oxytocin is the one that is being released during pregnancy and birth, right? Uterine contractions. So we have this positive feedback loop, right? Positive, and it continues and continues and continues. And also for the breast milk ejection during lactation and breastfeeding, right? Lactation is the technical term for breastfeeding process, right? All right, so now going for the anterior pituitary. Now, this is where most of the hormones from pituitary gland are going to be released and produced, right? So we have a lot, right? So we have according to the name also might actually help you to get an idea of what's going on. Well, assuming that you know what they mean. But let's see one by one, right? So the thyroid stimulating hormone is the hormone that is going to be stimulating the thyroid gland in order for it to make its own hormones, as we will see in a bit, right? This is also abbreviated as TSH, for thyroid stimulating hormone, right? Now, another group of hormones that are going to be produced are the ones that are called gonadotrophic hormones. These gonadotrophic hormones are hormones that will act in the gonads. Now, the gonads are basically the sex organs, basically ovary, uterus, and testes, depending on the case. But both FSH and LH will go and act in the gonads in order to produce a specific response, right? Depending if it's a male or a female, the answer will be different on the effect that it will have. But one thing is for sure, that the FSH and LH will be produced in the anterior pituitary, and they will be going to stimulate the gonads, right? Now, the third one is one that is called adrenocorticotrophic hormone, or ACTH for short, adrenocorticotrophic hormone, right? Now, this hormone is going to be stimulating the adrenal gland to release cortisol. This is what the name is telling you, right? So the adrenal gland, remember, was on top of the kidney. It was the one that was sitting like on top of the kidney, and this one releases cortisol. So ACTH will stimulate the adrenal gland and release cortisol as an effect, right? Now, prolactin is to produce the milk, right? In the case of breastfeeding, but this prolactin hormone is also present in men. It also has other functions, but the one that we'll be using as an example, because it's easier, is during breastfeeding or lactation. This one is the one that it will be creating or producing the milk, right? And growth hormone, as the name suggests, is for growing, right? We'll see details of each in a moment. All of these, remember, these are 1, 2, 3, 4, 5, 6. All of these 6 hormones are produced by the anterior pituitary gland. Now, let's see specifics about each one, right? So remember where the thyroid was located, right? In the neck, the lower anterior part of the neck. So it will stimulate the thyroid gland to produce the thyroid hormone, as we'll see in the segment for thyroid. This thyroid hormone can be either T3 or T4. Um, we don't need to know the differences between these two for this class. Just know that T3 and T4 are hormones that are being produced in the thyroid. All right. Gonadotrophic hormones, as I was just mentioning you, this FSH and LH will be produced in the pituitary gland, right? They will be released through the blood, right, in the blood system to stimulate the gonads to produce either, well, basically, estrogen, progesterone, and testosterone, right? Depending of what? Depending on the gland that is present, depending on the gonad that is present and developed, right? So if this system has an ovary, a mature ovary, it will be producing estrogens and progesterones mainly, right? And if the gonad that is present is a testis, then we'll be producing testosterone as an effect of this, right? So depending on the case, if we have the male gonad mature or the female gonad mature, we'll be producing different hormones depending on the case, right? Now for adrenocorticotrophic hormone, ACTH, this will stimulate the adrenal gland, as the name is telling you, adrenal, and to produce cortisol. Cortisol, right, is going to be the hormone that is directly responsible for this old trend that we saw before in the nervous system, fight or flight, right? Now, cortisol will eventually also create the stress response alongside the adrenaline, right? Which is also related to all this process, adrenaline, right? And noradrenaline, right? So all of this is kind of like in the same team. So it's helpful if you start putting all of this information together, right? At the end, cortisol, adrenaline, noradrenaline, all of these are related in the fight or flight, which is also called the sympathetic, right? Nervous system, or the sympathetic division of the autonomic nervous system. Prolactin, basically remember that this is the one for producing the milk, right? During the pregnancy, we will talk more about this particular case because it's also the example of a positive feedback loop, right? There's stimulus and more stimulus and production and stimulus and stimulus. It stimulates the mammary gland to synthesize. Synthesize means make breast milk, right? So oxytocin, as we saw this in the posterior, right? Posterior pituitary gland, we talk about oxytocin. This is for the ejection or the release. Prolactin is the anterior part in the anterior pituitary gland, is for the production. These two together work for the breast milk process. And the last one from this section of anterior pituitary is the growth hormone. Now, the growth hormone, as the name suggests, is to stimulate growth. And what are the things that are actually happening during growth? Basically, bone and muscle growth. Just as we saw back in the musculoskeletal system and the tissue section, we have, remember that the long bones have cartilage, right? And this is the growth cartilage. So the growth hormone will come into this cartilage and create more mitosis, mitosis, mitosis. So this continues to grow and expand. And as this cartilage becomes more mature, it will expand eventually into all this new bone that is being produced from an early, very young bone, right? So it will continue to grow, and this is how you actually grow in size, right? At the same time, in order to withstand all these changes in your physical dimensions, the muscle mass also needs to grow, right? So we can have more balance and more control of the whole thing. So in the growth hormone, there will be a stimulus of all of this. But at the same time, in the adipose tissue, if you remember, this type of tissue is synonym for fat. The adipose tissue will also be decreased as an effect of the growth hormone, right? So this baby fat that you have as a kid, it will eventually start to disappear as this person continues to mature and to grow into the adult form. And, you know, it continues and all the way throughout your life, but eventually this is one of the functions of the growth hormone. In technical words, increases protein synthesis. This is basically protein synthesis in here, and fat metabolism. So basically becoming slower and lower the amount of fat, right? Now, of course, this hormone has this function, but you know, it also depends on the amount of protein that you're taking in through the diet, the amount of exercise that is being done, you know, certain diseases, absent or present. So there's many conditions, but in general, growth hormone has this particular function. So in summary, for this pituitary section, we have the anterior pituitary with all of these different hormones that we just saw, right? We didn't talk about endorphins, but in the nervous system, we talked about endorphins, right? The ones for, you know, happiness and really and avoiding pain. And in the posterior pituitary, we talked about these two, antidiuretic hormone and oxytocin. Now, going on for the second type of gland that is included in the endocrine system, which is, well, two glands, thyroid and the parathyroid. Now, the thyroid gland is, as we have said before, is located here in the lower part of the neck, in the anterior part, and it has this like butterfly shape that is actually attaching or holding into the trachea. Um, you know, that's it, like to stay there, right? So normally the thyroid gland produces two thyroid hormones, T3 and T4. You don't need to know the names for these cores, but be sure to identify the T3 and T4 whenever it appears. It's about the thyroid, right? It's the two hormones that are produced by the thyroid, right? And in general, the thyroid, or the function of the thyroid, is to increase the metabolic rate. What is this metabolic rate? Is related to your metabolism. What is your metabolism? So your basal metabolic rate, this is what it means. Basal is like the basic, like the minimum, the metabolic rate, right? This is the minimum amount of energy that your body needs in order to keep working, right? Imagine if you're a factory, what is the minimum amount of electricity or work energy that it needs to continue existing, right? Forget about being efficient. It's just to keep you alive, right? So the T3 and T4, basically what it does, it increases your metabolic rate. So basically it pushes forward, gets into second gear, third gear, fourth gear in a car, in order for you to work more faster, more efficiently, or, you know, more at least, right? And in the chemical, if we see the chemical structure of this hormone, this element, iodine, which is in the periodic table, this is one element in position 53 of the periodic table. It's metabolically, is chemically needed for these molecules or for these hormones to actually work. So back in the day, there was some situations, especially in the north part of Mexico and the south part of the United States, where there wasn't enough iodine present in food or as a resource. And there were some cases, or a lot of cases, where this condition that is called goiter, bocio in Spanish, bocio, and this condition basically created an enlargement of the thyroid gland. So this created this like squishy area that it became more prominent. And it was basically because there wasn't enough iodine in food or in, available as a resource in the environment, right? So because of this, there wasn't enough iodine in the body. Therefore, T3 didn't have enough iodine, or T4 didn't have enough iodine, and this gland was not working well. So, changes in the body started to happen. And one quick way to actually fix this was to actually add iodine to the table salt. So you can actually see in supermarkets that there's like sal yodada, which has this iodine element also included, let's say artificially, into the salt. Right? And with this, most of the problems were fixed. Nowadays, it's not very common to see this situation anymore. So keeping in mind that T3 and T4 actually increase the metabolic rate to the max, to say it in a way, if we have a lot of it, we will call this situation a hyperthyroidism, right? And in hyperthyroidism, basically, we have a lot of metabolism. Let's keep it simple like that, right? Your metabolism is really, really fast. So because of this, all of your cells are working at maximum speed all the time, right? A little bit similar to what we saw back of sympathetic system. Well, everything is working in emergency. This is something similar. So most of the symptoms in the body will be related to working a lot or working very fast, right? Including something that we call tachycardia. Tachy means fast. So it's a fast heartbeat. You have a lot of blood pressure. You have a lot of weight loss. Even if you're not really trying, you're losing weight because you're consuming all the resources of the body, right? Because of that, you have also muscle wasting. The muscles are consuming themselves. All the protein is being taken. So there's a lot of, these, consuming the body situation, right? There's, a lot of tremors or shaking as well. Some cases diarrhea as well. And one particular thing is that there's always like, these heat intolerance. You have all heat all the time because everything is working at the maximum speed. So it's kind of like a computer that is working a lot. You touch the computer and it's actually very hot. The same with the body. If it's working too much, it starts to overheat, right? And one very characteristic things is these things in the eyes that we call the bulging eyes. It's actually looking like if he was a person really surprised all the time, but it's because the eyes are actually coming like a little bit to the front, out of the socket, right? All of these are symptoms or signs that the metabolism is highly, highly increased and it's not stopping, right? Normally, when you increase something, then it goes back to homeostasis, right? But in this case, it's constantly being stimulated. This is the opposite of hypothyroidism. Now, this hypo means low, right? So the metabolism, it's really slow. Nothing is working, not even in the basal, right? In the basic stage. So there's a very slow situation going on with the body. All the cells are really slow working. That's why there's a lot of, um, like cold situation, like you have contrary to the opposite, right? It's mostly feeling cold because there's not enough heat being produced in the system. There's this like slow thinking, like slow acting, slow reacting, slow speech. Everything is like very, very, uh, you know, slow acting. There's also even constipation because the intestines are not moving good enough. So there's a lot of constipation situation as well. And, even the heart, brady means very slow. There's a very slow heartbeat, you know. So everything, basically, the metabolism is running very, very slow. So the most common situation is, or the most common sign or symptom from here is that the person says, I'm getting more weight. I'm getting weight and I don't understand why. You know, I'm doing whatever I can with the diet and all that, but I keep getting more and more weight. And it's because of this situation that the metabolism is not fast enough. And this person usually becomes like puffy face and there's an increase in weight. Also related to the thyroid gland is a third hormone, which is called calcitonin. Now, calcitonin, just as the name suggests, it's related to calcium. Calcium in the periodic table is an element located in position 20. Calcium is needed for the correct function of our body, right? So calcitonin has one purpose, to lower the calcium in blood, right? So basically, if the calcium levels in the blood are increasing and increasing and increasing so high, then calcitonin is released and then the calcium goes back to normal, right? But how is it actually able to manage this, right? So it's not just throwing all the calcium away so we can go back to normal, but instead is putting into storage, right? Remember, in the bone, we have a lot of structures that are storage for calcium, actually. So calcitonin pushes all of this calcium back into the bones so we can use it later, right? But calcium also has a function in the muscle contraction, so you can actually move well. All the actions that the cell carries, all these processes that the cell does that you saw back last semester, calcium is a big part of this function. Whenever you have a wound and scarring process, calcium goes into play here, and also for the correct function of the nervous system. If you remember, the action potential is a changing or exchanging of ions, of elements. So calcium is also part of one of those, right? In general, what you need to know from here is that calcitonin has one specific purpose, which is lower the calcium in blood. How? Pushing it to all of these things so it can be used rather than just being thrown away, right? So in general, when we talk about the thyroid gland, we talk about two hormones that are involved in metabolism, T3 and T4, and one hormone that is involved in the calcium lowering process, right? But remember, let's start to connect with the pituitary. Remember that in the pituitary gland, right, we were releasing TSH, right, in the anterior part. In the anterior pituitary gland, we released thyroid stimulating hormone. So the thyroid stimulating hormone will stimulate the thyroid gland, so we will have more T3, T4, and calcitonin, right? If we have a lot of this, if we have a lot of T3, a lot of T4, or a lot of calcitonin, this will come back to the pituitary gland and tell them, you need to stop. We have enough. So then the stimulus will shut down, right? This is an example of negative feedback. The stimulus that was created now stops because the result will go back and tell it, cancel, stop. We have enough, you need to shut down, right? And here in this slide, there's, just an example of how calcitonin works. In general, remember that calcitonin main function is to lower the calcium levels in the blood. Specifically, the mechanism of how it's not needed in here, it's available if you're interested. Basically, storage of calcium into bones, stops, stops the absorption in the intestine. These mechanisms are not really mandatory for you to know, but to be related or familiar that calcitonin lowers calcium in blood, right? Now, interestingly enough, the parathyroid will create a parathyroid hormone. And this parathyroid hormone will be the opposite, will be the contrary of the calcitonin, right? If calcitonin is to lower the amount of calcium in blood, parathyroid hormone will be to increase the calcium in blood, right? So parathyroid hormone or PTH will be in charge of increasing the calcium in blood, right? Why? Because if it lowers a lot, then we need to bring it back up, right? This is the basic concept of homeostasis, right? We want to keep exactly one range all the time, because if we go up, then there's a disease. If it goes down, then there's a disease. So we want to keep it in here, right? How do we manage this? With calcitonin turning it down and parathyroid pushing it up, right? If these two things work together, then your calcium levels in blood are good, right? Again, the mechanisms of how this is done is not mandatory, but just to identify the hormone and the overall function. So the parathyroid, basically, in order to increase it, one of the most abundant mechanisms that it does is it goes back into the storage in the bone where you have a lot of storage of calcium, and it starts to releasing it back into the blood. So it goes back up. Now, the pancreas. The pancreas, remember, is a double function, or has two roles. One in the exocrine gland in the digestive system, and the other one as an endocrine gland in the endocrine system, right? So this I included in here so you can pick up again and start studying for the final exam. So the exocrine gland, or the exocrine part, releases digestive enzymes and bicarbonate, which is what we saw in the digestive system, right? Remember, bicarbonate to neutralize the stomach's acid. And in the endocrine part, we will have two hormones being produced, insulin and glucagon. Now, these two hormones act pretty much the same as calcitonin and parathyroid with the calcium. But in here, we will talk about sugar, which is called glucose in the body, right? So both of these hormones, insulin and glucagon, will work in order to have homeostasis of glucose, right? So insulin will decrease blood glucose and glucagon will increase the blood glucose, right? So they are also working in the opposite direction to keep a balance of glucose in your system, right? So how does it actually make it? Insulin is a hormone that will act as a key. In the cell, there are many doors, depending on the thing that is trying to get in, right? So there's a special door that only works for glucose. And the only way that we can open this door is with insulin, right? Insulin is going to be the key that will open the door so that the cell can be, pushing inside all of this glucose. And that glucose is needed for everything, right? ATP, the mitochondria, and many other things. So basically, if there is no insulin present in the system, then the glucose is not going to be able to go inside. So they're all going to be waiting outside in the blood forever, right? So they won't be able to act and do whatever they do, right? So insulin lowers the amount of glucose in the blood, not by throwing it away, but by pushing all of this glucose that is in the blood into all of the trillions of cells that you have in your system. So eventually it's being consumed, like gas in your car is being consumed and eventually starts to lower, right? So as in your car, right? The gas is going down not because you're throwing away the gas, but because you're using it, you're consuming it, right? And the opposite happens. Once the insulin pushes all the glucose into the cells, then eventually you run out of glucose, right, from your blood. But back when you were eating in the digestive system, all the excess sugar was actually stored in the liver and in your muscles, right? Your muscles and your liver actually stores a lot of sugar, a lot of glucose. So when the glucose actually goes down in the blood, glucagon, the hormone, will go and act in the liver and in the muscles to start to bring out all of the stored glucose that is present there, so we can pick up again the levels of glucose in the blood, right? Now, as this starts to increase, insulin acts again, and we continue the cycle of feeding glucose to the cells. Now, for the last two glands, which are the gonads, that the same hormones are going to be acting in the gonad, depending on the one that is present, right? So if this organism has testes, then the gonadotrophic hormone, which is FSH and LH, will be mainly producing testosterone in the testes gland, right? The testosterone is directly responsible for the male secondary sex characteristics, which includes growth of the sex organs, increasing the beard production, increasing the muscle size, the bone. Remember, here we have connection with the growth hormone, but also has some effect also in the psychological aspect, the mind, psychiatric aspect, with a boost of confidence and a boost in the memory retention also. We have also in male enlargement of the vocal fold, so the voice becomes deeper, more lower, right? And stimulates oil production in the oil glands. That's why also the acne becomes very prominent at this age during early teenager years. But also reaching usually the age 30 or a little bit above, we have also presence of baldness. For whatever reason, and we have an increased muscle development as well during this particular stage of life, right? Now, important to mention that women also have certain levels of testosterone, not at the same level of an average male, but this is also present in women. But what is also going to be mostly present in women is also the same hormones, FSH and LH, but it's going to be producing mostly estrogens and progesterones. These are going to be directly produced in the female gonad, which is called the ovary, right? So estrogens will be responsible for the female secondary sex characteristics, which includes, also the breast development, the growth of the uterus and vagina, and the egg maturation. Basically, this egg maturation is the one that is going to be involved in the menstrual cycle process, right? Progesterone, together with estrogen, will be the main regulation for this menstrual cycle, and which includes both these. There's two cycles, one in the ovary, the ovarian cycle, and the cycle of the uterus, so that uterine cycle. These two cycles together are what we call the menstrual cycle, and we will see more of this in the next lecture, which is for reproductive system. Now, for the last section of this lecture, we will see some of the disorders that are going to be included from the endocrine system, and it's important to identify them according to the gland, right? So we will start first with the ones that are involved with the pituitary gland. So if you remember, part of the pituitary gland, specifically the posterior pituitary gland, we have the ADH hormone, which is antidiuretic hormone. This is not the same as ADHD. This is a different thing, right? This is attention deficit hyperactivity disorder. This is a psychiatric thing, different system, different topic completely, right? This ADH is antidiuretic hormone. If you remember, diuresis means urine. the kidney makes urine, right? So the a very low level or a very deficient level of ADH hormone will cause large amounts of urine producing dehydration situation, right? So this condition normally is called as diabetes insipidus. Insipidus comes from the name that it has no taste, right? In Spanish is insípido. So something that is insípido, it has no taste, right? And the reason for this is to differentiate from the other type of diabetes, which is called diabetes mellitus. This is the regular diabetes that when often people talk about, right? So diabetes mellitus, the name suggests mellitus basically comes from Latin, meaning honey, miel, right? Because it's very sweet. The main difference in here is that this type of urine has no sugar, which is the main problem in diabetes mellitus, right? In here, there's no sugar, so the urine is not sweet. So think about how this might have been discovered, right? So yeah, basically diabetes insipidus is a problem with very low levels of ADH, therefore throwing a lot of water and resulting in dehydration. Remember, this is a problem with the pituitary gland, right? Which is going to be different from the other type of diabetes, which is the pancreas. Now, also in pituitary gland, we have what we call a pituitary dwarfism. Now, this issue is directly related to the lack of growth hormone uh, due to the one that is in the anterior pituitary, right? So we don't have enough growth hormone, therefore, this organism, this system, is not going to be stimulated enough to create this enlargement of the bones and enlargement of the muscles as it would be, expected in an average human, right? So the result will be an organism or an individual that will have a small stature, but the proportions are normal, are average, right? So the proportions within the system are average or are what expected. It's just that the stature is small, right? This is usually due to very little release of growth hormone, uh, coming directly from the pituitary. Now, what happens if we have the opposite situation, right? If we have an excessive amount of growth hormone being produced, especially during childhood. This is a keyword. We'll compare it with adulthood, right? So if we have this situation happening from childhood, then we have a condition that we call gigantism, right? And this is basically because during all the childhood, during all the development process of this human, there was a lot of stimulus from the growth hormone. So a lot of the bone was stimulated a lot. Muscles were extra being stimulated. So at the end, the result will be a very, very excessive height, let's say, right? Now, if this same situation, this excess growth hormone is done not in childhood, but during the adulthood, then we need to remember that by the time that you reach maturity or adulthood, all this cartilage is already closed. So the bone will not continue to develop further. So the result will be that all the other things that are able to continue to grow will do, which include basically the hands, the feet, and the facial bones. This is the three places that this excessive amount of growth hormone that happening only during adulthood will have the greatest impact, right? So you can see the changes in the facial structure. It's not very visible in this image, but you can also see it in the hands and in the feet. This condition we called acromegaly. Acro is basically making a reference to like the things that are, like our hands and feet, and mega, is enlargement. So acromegaly is the result of excessive growth hormone during adulthood. So all of these previous ones were related to the pituitary gland. Now, this next gland, or these next disorders are related to the thyroid, right? And we have talked about this slightly in previous slides, and the hypothyroidism. Remember, hypo is very low thyroid stimulating hormone, and as a result, we will have very low T3 and T4, right? So the thyroid gland is not going to be stimulated enough. So in these cases, the symptoms includes, as we were talking about, weight gain, especially because the metabolism is really, really slow, right? So there's going to be constipation and sensitivity to cold also as a result, right? Fatigue, there's going to be hair loss also, irregular menstrual cycle. These conditions, all of the conditions that are related to the thyroid, are often seen mostly in females. For what reason in particular, I'm not entirely sure, but it's actually mostly present, statistically speaking, in females, right? Now, the treatment for this one is actually pretty simple. You have to basically provide the hormone, right? So if you don't have enough of the thyroid hormone, the condition or the thyroid hormone will be the medication, so we can actually come back to the regular stage or the regular or the average function of the system, right? Now, the opposite happens is if you have a lot of the stimulus, right? So if you have a hyperthyroidism, that means that you have a lot of these particular hormones, right? So the metabolism will be, going faster than usual. So as a result, remember, we would have a hyperactivity, and as a result, we will start to be losing weight because we're consuming all of the resources in a constant way, right? There will be high blood pressure. We would have an increased heartbeat, anxiety stages, trouble sleeping because you're at maximum level all the time, right? And the very classic sign is these protruding eyes. It looks like maybe the patient is kind of like forcing the eyes to be this way, but it's actually the resting stage or the resting state of the eyes. And this is very, very particular sign of this condition, right? Also, you may notice here in the neck, we have an increased, it looks like puffy, right? It looks like maybe there's like a little bit of water in there. This is actually the thyroid gland being increased um, in size as a result of this, right? Basically, the treatment in these cases, you remove part or the complete gland of the thyroid. And if it's a complete destruction of the thyroid, basically, you need to provide additional hormone to come back to the regular state, right? So going from the before and to the after the treatment. Also related to the thyroid, basically, if we have, as we were mentioning before, that there's insufficient iodine content in the system, we have this condition that is called goiter, bocio in Spanish. Now, the one in the left is obviously an extreme case of this, but most notably, you will also see this particular area, just as the previous patient, that you have an enlarged area over in the neck, right? So it could be both situations. That's why it's important to go have a medical consultation so we can define which of these conditions is the one that is, if it's goiter or if it's a hyperthyroidism. But basically, this lack of iodine is the one that is unable to produce enough of the thyroid gland hormone, and therefore it will start to increase inside to try to compensate the lack of hormone, right? Eventually, the treatment is very simple. You just provide the iodine. In most of the cases, go back to normal. Now, going to the next gland, which is the pancreas. In the pancreas, this is where we will have diabetes mellitus. This is the let's say, the general aspect. Well, whenever we talk about pancreas in the endocrine system, diabetes mellitus is the most important condition that we need to talk about, because this one is basically, in general, whenever we talk about diabetes, we talk about this one in particular. And the problem is that the cells cannot take up glucose for one reason, for whatever reason, right? There can be different reasons, but at the end, there's an increase of glucose in the blood. So because of this, there's an excessive amount of glucose that is going to be lost in the urine, because normally you have a decent amount of glucose and the kidney can manage it, right? Okay, one glucose here, one glucose there. And normally there's no glucose being lost in the urine. But when there's a lot of it, there's a lot of glucose being produced or present in the blood, then the kidney basically cannot handle all of the charge or all of the, all the other overwork that it needs to do. So all of this glucose sugar is going to be starting to get lost in the urine, and therefore the urine has a lot of sugar, right? So both the taste and the smell will actually be very sweet. This is where the name actually comes from. So you can use your imagination to define who actually came up with this, right? So some of the symptoms include thirst and increased hunger. And this basically is in a constant way because the cells are starving, right? Even though there's enough sugar in the system, the insulin, which was the key to open the door, is not working, right? For some reason. So the cells are, hungry. So the hunger stimulus and the thirst stimulus will be constantly expressing themselves, right? So if we have diabetes mellitus type 1, this type 1 is usually the one that appears or is being manifested early in life. I mean, children, right? Children or very young teens. Usually it doesn't go further than that, right? This is basically because from a genetic point of view, there is no insulin being produced in the pancreas, or the amount is very, very, very little. And eventually let's say the resources start to diminish. So at some point, these patients, young patients, actually need to start injecting the insulin, to compensate or to have this balance between the level of glucose with each and every meal, right? Now, the problem with insulin is that if you overdose or if you put more insulin than you should, the insulin will dramatically lower the amount of glucose in the blood, and then we have the opposite condition, right? Which is hypoglycemia, which means low blood sugar. Sorry. So this as well makes the person to become unconscious, and it needs to keep the glucose back into the normal range or the normal level, right? So in diabetes mellitus type 1, the problem is genetic. It's usually hereditary and it's found at a very early stage. And the treatment is always with insulin. However, in diabetes mellitus type 2, this one unfortunately is, or I don't know, the fact is that is the most common one, right, in the world, especially in Latin American countries. And this one is usually related due to obesity and other factors like like a bad diet and lack of exercise, hereditary factors as well, like family history and all of this, right? This one usually appears later in life, usually above age 35, but is mostly related to the lifestyle of this particular person, right? So in here, the problem is not that there's no insulin, but that the cells are becoming insulin resistant. the cells are no longer identifying, for whatever reason, the insulin. Like the insulin might be there, or might be actually also, depending on the case, it may actually also be diminishing. But the fact is that the cell is becoming insulin resistant. So there needs to be specialized medication in order to push forward a little bit more the cells to be reactive towards the insulin, or to pushing the cell to open the channels so that the glucose can actually get inside, right? So usually these are, if it's detected early, which is the hope for all of these conditions, usually with diet and exercise, significant changes can actually be achieved, even before oral medication. But most of the time, if the disease or the condition is already advanced, we need the three of them. Is oral medication and exercise and the diet, right? So not just because there's medication, we can disregard the lifestyle changes. This is the base of the pyramid, so that the rest of the things that come later can actually work also, right? So there's long-term consequences, serious long-term consequences if this is not under control at an early or even mid stage of the disease, right, of the condition. So usually these conditions go from blindness to serious kidney disease, some cardiovascular disorders, and even serious conditions in the skin, infections, many things, right? So at the end, the basic or the core of this treatment and control of this condition is based in diet and exercise. It is both paradoxically easy and difficult. Easy in concept, but difficult to keep it. Most people do some time and then they get bored or tired and they go back to old habits. So it's important that at a very early age, especially during teenage years, these good habits and elimination of risk factors are set in motion. So when later in life, 15 years, 16 years later, that these habits are not something truly difficult to achieve, and that is already in your state of mind and lifestyle changes. All right, so in summary, from diabetes type 1, basically there's an insufficient amount of insulin, and diabetes type 2, we have basically very little insulin produced, but mostly is that the insulin receptors are not responding, right? This is usually in young patients, and this is usually in not elderly, but like adult, let's say, well, usually it was above 40, right now is like 35 already. So let's say more than 30 years old, right? All right, so with this, we finish this section of the endocrine system. Hopefully this was beneficial for review purposes or to answer your review activity. Let me know if you have any questions from this topic or any other thing that I might help you with, all right? So have a happy holiday and I'll see you back at campus later. Goodbye.